Yeah, this is Dr. Caudill Miller, the brain doctor. We've been talking a lot about headaches. I'm just going to talk today about a patient that I treated with tension headaches and sort of go through, what I did over an extended period of time. Tension headaches are a little bit different from migraines. Migraines are just never 24 hours a day, 7 days a week. This person was 40 years old. They'd had headaches for 20 years. Didn't really remember many days where she did not have headaches. So 7 days a week, 24 hours a day, that's never a migraine headache. She had tension headaches. They're more like a vice. She had a pressure, like somebody was just squeezing on her head. Sometimes when they got bad, she would get some nausea, rarely vomited. A lot of people with tension headaches, they'll progress to what we call tension type headaches with transform migraine. Sometimes the light would bother her. The sound always bothered her. You see that with migraines. You see with tension headaches. It wasn't really worse with any movement. She had no focal depth. She just had a headache all the time. Went through her treatment history. She'd been given a lot of different pain medications and taking Advil and goodies. And the Advil and goodies didn't work for a while, but then they sort of quit working. She had an MRI of her brain multiple times. They were all normal. CTs of the brain were normal. And what people don't realize is that, the brain doesn't feel pain. You can stab the brain, it doesn't hurt. If y'all remember Silence of the Lamb 2, where he was eating Ray Liotta's brain, they had a neurologist on the set that sort of tried to make that realistic. They say that's one of the reasons that Silence of the Lamb 2 didn't do very well. That scene was so gruesome. There's no pain fibers in the brain. The brain is a computer that feels pain. The pain comes from the arteries, the veins, the tendons, the coverings of the brain. It doesn't come from the brain itself. The brain is a computer that feels it. So we talked about the different pathophysiological mechanisms of headache, a constriction of blood vessels and vasodilatation, a release of chemicals, and then a tsunami of electricity. So we talked about the different medicines we use in these classes. Well, for tension headaches, we usually use the medicines that treat the electrical mechanism or the biochemical mechanism. So in her case, I put her on a medicine called Pamelor, an antidepressant. Pamelor increases serotonin and norepinephrine, probably norepinephrine more so than serotonin. And serotonin will block the substance P receptors. It takes 6 to 12 weeks of work. I always warn patients, 30 to 40% of women gain weight on it. And so you have to just have them weigh every week. I give people a headache calendar, which is on my website. I like it because it's one page on one day. And just watch your weight because you'll gain weight. Now, Americans are all gaining weight anyway, so you have to really be careful. And so, that's sort of my favorite. Now, she was pretty thin and really not overweight. And so, Pamelor is a really good choice for her. If she had been overweight, I would have used Cymbalta or Effexor, which I later did use on her. So that was my first line drug of choice for her. She said after about a couple of weeks, it started getting better. I doubled the dose. It got a lot better, but her headaches were not totally resolved. So then I talked about what to do next. So Pamelor is working, but it's not working quite as good as we would like. So, the next step was to look at the second mechanism, and so I put her on Topamax. I'd say for headaches, by far Topamax is the one we use the most. It's just a great medicine for headache prevention. Don't use it if you have kidney stones or glaucoma, but Topamax really works great, and that's what I put her on next. So she was on Pamelor and Topamax for a very, very long time. Now I could have used some other things. Definitely Topamax and Keppra are our favorite choices in the, electrical mechanism pathway. So you could have put her on Pamelor and added Keppra, or I put her on Pamelor and added Topamax. You could have put her on Cymbalta and added Topamax, or Cymbalta and added Keppra. You could put her on Effexor and then added Topamax, or Effexor and added Keppra. Other anticonvulsants we use, Vimpat or Zonogram, those would be the main two. It's sort of interesting. You don't really get too much further past Topamax and Keppra. They work so well. So she continued to do really well over a long period of time, and then the headaches started creeping back, and I tried a bunch of other things. So what else might you try? People have over 15 headaches a month, and they even have a mixed headache picture. Then our drugs that affect the trigeminal vascular system are worth a try. I actually put her on Amyavig, and I think that was a second life changer for her. It was like 20 or 30 years later after I started Pamelor. You could have used Emgality or Ajovy, which would have been worth a try. You know, I tried all the regular triptans. Triptans don't usually work for migraine. So she took Midrin for years and years and years and years till she got a hard time getting. I love Midrin, just can't get it unless your specialty pharmacist will make it. So I tried Nurtec on her. It really worked well. Nurtec, you know, is a really good option if triptans don't work. And you know, so Ubrevely would be another one. So she got on Nurtec and worked well. And as the Pamelor caused her to gain some weight, you know, weaned her off that, she got a little bit worse. So I put her on the daily Nurtec. And so she really did well. After about 30 years, her headaches just got to be just annoying and daily. And I decided to try Botox on her. You have more than 15 headaches a month, and Botox just worked great. And so I gave her 31 injections about every 3 months, and that's sort of where she is now. She really felt she did the best on the Pamelor, so we put her on a healthy eating program. She's back on Pamelor. She's probably 15 to 18 pounds over what she was when I first saw her 30 years ago. So that's sort of a typical patient that I treated over a long period of time for tension headaches. So I would say tension headaches, use antidepressants or anticonvulsants starting out. And maybe with a 2 or 3 week course of an anti-inflammatory to help them kick in. And then cross over to some of the anti-migraine drugs, the trigeminal vascular mechanism drugs, Botox, and just keep plugging away, because probably half the people with tension headaches have a mixed headache picture. And we can talk about that later. So that's a patient I treated with tension headaches. More later. Now like my channel, subscribe, make comments, and we're going to continue to add videos on a weekly basis.